Let's take that graphic if we could show our viewers. People at average risk of colorectal cancer should start regular screening at 45.
Yeah, so that's a new change. Unfortunately, given the increased risk of colon cancer in younger patients, we've changed the screening recommendations from 50 to 45. And average risk patients, so what does this mean? These are patients who typically don't have any identifiable risk factors that increase their risk of colon cancer. Typically, these are patients who have a history of inflammatory bowel disease, such as Crohn's or ulcerative colitis. Also, patients who have a family history of colorectal cancer or other diseases such as FAP, familial adenomatous polyposis, diseases that increase your risk of developing colorectal cancer.
All right, let's go back to the graphic and read a few more guidelines. People who are in good health and with a life expectancy of more than 10 years should continue regular screening through the age of 75.
Yes.
All right. People ages 76 through 85 should make a decision with their medical provider about whether to be screened. And people over 85 should no longer get colorectal cancer screening. Again, guidelines that are important to remember.
Yes.
Now, let's look at what puts people at higher risk for developing colon cancer. And this is obviously very important to look at. So if we could take that graphic and we'll see what the risk factors are. Why don't you take the first one, doctor?
Sure. Again, a strong family history of colorectal cancer. So anybody who has a first or second generation family member, such as a father or mother, an uncle with colorectal cancer is considered to be at higher risk to developing the disease, usually two to three times higher than the person who doesn't have any identifiable risk factors. Patients who have polyps, such as patients with familial adenomatous polyposis, again, are a higher risk. And any type of inflammatory bowel disease, those patients that increase risk, there's a very strong link between inflammation of the intestine and the risk of colon cancer. So these patients are screened a little bit more tightly than someone with average risk.